We're really proud to be members of the UK Health Alliance on Climate Change, and we are a multi-professional organisation, so we have doctors, pharmacists, physios. I'm a physiotherapist myself as part of our society, and we are really committed to raising awareness of the effects of poor air quality on lung health. And we are active members of organisations such as this and the Clean Air Champions. We produce educational programmes and materials for healthcare professionals, and we provide respiratory expertise to stakeholder organisations to help raise this awareness on a national scale. And most importantly, we produced the BTS position statement on air quality and lung health earlier this year in June. And that really called the government to action in terms of consulting on, implementing and monitoring the air quality to make sure it's safe for us to breathe and safe for our patients. And we also called for national policies to implement air quality, so for example levelling up and the health disparity report, really making sure that air quality and climate change was included in those national policies. We wanted to national awareness and action to reduce exposure to harmful pollutants that we know contribute to respiratory disease, and really fund research so we could really understand the impact of poor air quality on lung health and respiratory disease, and then of course how we can mitigate that exposure to make it safer for our patients. So yes, we're really active in this space. It has been a journey, but we hope to raise awareness and producing the evidence, collating the evidence and producing the evidence and why it's relevant to people will really create that meaningful change. So one of the things is raising awareness across from board to floor. So we've I don't think we've announced who was successful in the interview process, but we've appointed a sustainability trustee who is one of our members and who will feed into the board, help us develop a really sustainable
so coming
program.
Right in at the top level to make sure there's a priority setting.
Yeah, they're a clinician. They're obviously going to be a respiratory clinician, and they will really help us set our agenda, which will influence nationally, locally, and of course will benefit our patients. Things like carbon-friendly medicines, so as you know, respiratory inhalers are one of the most expensive and most prescribed pharmacology. So carbon-friendly inhalers, education around that, including shared decision-making, so with the patient, because obviously that can be quite a terrifying time if someone's had an inhaler they've worked with for years. Recycling, transport, and housing. You know, the environment is a massive factor for us in terms of the conditions someone lives in and the pollutants they're exposed to in terms of occupational lung disease. So yes, we've still got a lot of work to do, and it's how we get that message out to every single clinician and how they make that contact with the patient count, and how we work with social care as well, because I think that's something that we don't do very well to help reduce them or address them healthcare inequalities that exist. One of our frustrations as respiratory clinicians is when we try and address housing issues, for example, or exposure. It's very, very difficult. No one takes accountability for it. So that's one of the things that is going to be on the new Sustainability Trustees agenda for sure, in how we can lobby and how we can get real traction to help provide that, what meaningful action looks like, what we're asking for. Not wanting to repeat anything, but to maybe take a different angle, I agree that we are, and obviously as a therapist, we are public health clinicians, but we don't work in a system that enables that. So we've become specialists in silos. Obviously, exclude our GP colleagues in this, but gone are the days of general medicine, if you like. So when patients get diagnosed with something, they get diagnosed with a disease or a condition, and people tend to focus on that. They don't think of the whole person. So I think if we're really truly committed to being public health clinicians, then we need to look at how we operate within a health and care system. And actually, I spent some time on the Scottish Isles, they've got some great examples of global healthcare systems in remote areas because they have to be, they don't have those specialists. So it's kind of like how we can take step backs to look at, yes, a patient has a disease or a condition, but also that they're part of what are the wider determinants of health. And if you think of what NHS England, is England-centric, with Core Plus 25, and that agenda about looking at specific areas of health and how we can reduce those, wider determinants of health.